Have you been dealing with chronic pain, slow recovery after workouts, nagging injury that just won't heal? What if I told you there is a peptide that can supercharge your healing, protect your gut, support your joint, and even boost your brain health? Hi guys, I'm Jwalant Patel, a certified PA here at MyFitMed, and I specialize in hormone replacement, weight loss, and peptides. And today I'm breaking down the most underrated healing peptide in the game, BPC 157. Let's talk about how it works, how to use it, what to watch out for, and how it stacks with your weight loss meds and other peptides. BPC 157 stands for Body Protection Compound 157. It's a synthetic peptide originally derived from protein in your gastric juice. Yep, from your stomach. It's not FDA approved for medical treatment, but it's widely used in the functional medicine, fitness, and biohacking world for its insane ability to heal the tissue, like tendon, muscle, gut lining, and even brain. What makes it cool is it works in multiple forms, injectable, oral, and even topical. So you can use it depending on what you are trying to fix. Let's geek out for a second. Injectable BPC 157 goes straight into a bloodstream. It increases blood flow, supports angiogenesis, that's the growth of new blood vessels, and promotes tissue regeneration. Oral BPC 157 acts locally in the GI tract. Great for gut healing. It helps rebuild the gut barrier, reduces inflammation, and helps with things like IBS, ulcer, and leaky gut, common gastric problems. Whereas topical BPC 157 works through skin absorption and helps with wound healing, skin inflammation, soft tissue recovery, used for cosmetic purpose to improve skin quality and repair for anti-aging. It's like putting your body in healing override without steroids, surgery, or downtime. So benefits of BPC 157, let's break it down by the form. Injectable benefits: faster injury recovery for muscle tear, tendon injury, joint pain, post-surgery recovery support, great for chronic pain, especially in active individuals or athletes, improved blood flow to damaged areas. Oral benefits: heals the gut lining, helps with gastritis, acid reflux, leaky gut, IBS, reduces inflammation in GI condition and improve overall GI health. Topical benefits: helps heal cuts, burns, scars, great for acne-related inflammation, promotes collagen production in the skin, great for improving overall skin quality. Now let's make it real. Athletes, got a shoulder injury from lifting? Use injectable form for systemic effects. Fitness lover, nagging knee pain from running? BPC helps tendon and ligament recover. Desk workers, neck tension, back pain, micro tears from posture strain can benefit. Gut issues, bloating, heartburn, ulcers, that's oral BPC territory. Acne, rash, scar, use topical BPC. BPC is not just for athletes, it's for busy moms, weekend warrior, hard workers, and anyone looking to heal faster and feel better. Let's talk about the dosage. Injectable. Typical dose is 200 to 500 mcg per day sub-Q. Cycle 6 to 12 weeks depending on severity. Oral. Capsule or sublingual 500 to 1000 mcg per day. Can split AM and PM dosing. Cycle 6 to 12 weeks for gut health support. Topical. Use once or twice daily over clean skin. Apply a thin layer on affected areas. And here is the pro tip. Stack injectable plus oral for total healing. Systemic plus local. Get the best out of BPC 157. Let's talk about the side effect of BPC 157. Side effects are rare, but here is what to watch for. Mild nausea or headache, usually dose related. Redness or irritation at the injection or topical site. Clean the site before injecting. Allergic reaction, although very rare. Most users report no side effect and great tolerance. Contraindications. Avoid BPC 157 if you are pregnant or breastfeeding. If you have active cancer, any compound that promotes cell growth should be used with caution. If you are allergic to peptides, rare but possible. Always talk to the qualified providers like us at MyFitMed before starting any peptides. Here is the fun part of combining BPC 157 with other compounds. Can you use BPC 157 with GLP-1s like semaglutide or trizeptide? Yes, in fact, it's a power combo. While GLP-1s help with the fat loss, BPC 157 supports healing and GI protection, which is huge if you're experiencing nausea or gut discomfort, which is the most common side effects with GLP-1s. Here are the other peptides to stack with. So you can stack BPC 157 with TB500 for injury repair, CJC ipamorelin for growth hormone support, AOD 9604 for fat loss, Think of BPC 157 as a healing backbone of your protocol. It works well with everything and fills the recovery gap that most weight loss regime misses. BPC 157 is not a magic bullet, but it's the closest thing we have got to biohacking repair tool that helps you heal faster, train harder, recover smarter, and support your gut in the process. Whether you are on your fitness journey, recovering from injury, or optimizing your health, this is something you want in your corner. What if I told you there is a peptide that can heal your gut faster than anything you have ever tried, reduce inflammation like a prescription drug, but without the side effects, and boost your athletic performance at the same time? I'm talking about KPV peptide. And by the end of this video, you'll understand why biohackers and athletes are calling this a holy grail of healing peptides. Stick around because I'm about to blow your mind with what this little molecule can do for your body. Hi guys, I'm Jwalant Patel. I'm a certified PA and I specialize in weight loss, hormone replacement and HGH peptides. KPV peptide is a tripeptide, meaning it's made up of just 3 amino acids, lysine, proline and valine. But don't let its simplicity fool you. This small but mighty peptide is derived from alpha melanocyte stimulating hormone, and it's literally changing the game for people dealing with inflammatory conditions, gut issues, and performance plateau. Think of KPV as your body's natural firefighter. While other treatment just masks the symptoms, KPV goes straight to the source of inflammation and puts out the fire from inside. It's like having a reset button for your immune system. What makes KPV special is that it's naturally occurring in your body. But as we age, get stressed, eat processed food, or deals with chronic conditions, our natural production drops. That's where the supplementation comes in. The best part, unlike harsh medication that comes with a laundry list of side effects, KPV works with your body's natural healing mechanism. It's like upgrading your body's software without changing the hardware. So, mechanism of action. Here is where it gets really interesting. KPV works through multiple pathways, but let me break it down in a simple terms. First, it's powerful anti-inflammatory agent. It inhibits something called NF-kappa beta. Think of this as your body's inflammation switch. When this switch is stuck in on position, you get chronic inflammation all the time. KPV literally flips that switch to off. Second, it modulates your immune system. Instead of suppressing it like steroids do, KPV teaches your immune system to be smarter. It tells your immune cells to calm down when they are overreacting but stays alert when real threat appears. Third, it promotes tissue repair and wound healing. KPV increases collagen synthesis and accelerates cellular regeneration. This is why people see improvement in gut lining, skin condition, and even muscle recovery. The mechanism is so elegant because it doesn't just treat symptoms, it addresses the root cause of inflammatory dysfunction. It's like having a personal trainer for your immune system. The benefits of KPV are honestly mind-blowing. Let me run through what people are experiencing. Gut health revolution. KPV is like a miracle worker for your digestive system. It heals leaky gut, reduces intestinal inflammation, and restores the gut barrier. People with IBS, Crohn's disease, and ulcerative colitis are seeing improvement that they never thought was possible. Skin transformation. If you are dealing with eczema, psoriasis, dermatitis, or just stubborn acne, KPV can be a game changer. It reduces skin inflammation from inside out and promotes healing of damaged tissue. Athletic performance. Here is what gets me excited. KPV reduces exercise-induced inflammation, speeds up recovery between workouts, and helps prevent overtraining syndrome. Athletes are reporting they can train harder and recover faster. Pain management. Chronic pain from inflammation responds incredibly well to KPV. We are talking about joint pain, muscle pain, and even neuropathic pain. Autoimmune support. For people with autoimmune condition, KPV helps modulate overactive immune system without suppressing immunity completely. Brain health. Emerging research shows KPV can reduce neuroinflammation, which means potential benefit for brain fog, cognitive function, and even mood. The beauty is that these aren't isolated benefit. They all work together because inflammation is the common thread. So let's get real about everyday problem KPV can solve. These are the symptoms my follower asked me about constantly. That afternoon energy crash could be inflammation from leaky gut. KPV helps heal the gut lining, reducing systemic inflammation that zaps your energy. Skin that just won't clear up. Whether it's adult acne, eczema flare-ups, or stubborn rash that won't go away, KPV addresses the inflammatory root cause. Digestive issue that's ruining your day, bloating after meal, irregular bowel movement, food sensitivities, KPV is like a reset button for your digestive system. Sore muscle that never seems to recover. If you're training hard but not recovering well, inflammation might be keeping your muscle in a constant state of stress. Brain fog that makes you feel stupid. Neuroinflammation is real, and KPV can help clear the mental cloudiness that holds you back. Joint stiffness that makes you feel older than you are. Inflammatory joint pain responds incredibly well to KPV therapy. The key is understanding that these seemingly different symptoms often have the same root cause, which is chronic inflammation. Now let's talk about how to actually use KPV and dosage. There are three main delivery methods, and each has its place. Injectable KPV, this is a gold standard for systemic effects. Typically, dosing range from 200 to 500 micrograms per day, usually given sub-Q. Start low and work up. Most people inject once daily, preferably in the morning. The bioavailability is nearly 100%, so you get maximum benefits. Oral KPV, less bioavailable than injection, but still effective, especially for gut-related issues. Dosing is typically higher, around 1 to 2 milligram per day. Take it on an empty stomach for better absorption. It comes in capsule and sublingual drop. Whatever you prefer, both have equal efficacy. Topical KPV, perfect for localized skin condition. You can apply it directly to affected area 2 to 3 times daily. It's great for eczema, psoriasis, or healing wound. A lot of pharmacy has been making combinations of topical formulation of KPV. My recommendation, start with injectable for systemic benefits, then add topical for specific skin issue if needed. Oral is great if you're needle phobic. Always start with the lowest effective dose and titrate up based on your response. More isn't always better with peptides. So let's talk about the side effect. Here is the good news. KPV has incredibly clean side effect profile. Most people tolerate it extremely well. The most common side effects are mild and temporary. Slight injection site irritation if using injectable form, mild fatigue during the first few days as your body adjusts, occasional mild nausea, especially with the oral form because it has to be used on an empty stomach. Rarely, some people might experience temporary skin flushing, mild headache during initial use, change in an appetite. The key word here is mild and temporary. Unlike harsh medication, KPV doesn't suppress your immune system or damage your organs. It works with your body's natural processes. Most side effects resolve within a few days as your body adopts. If you experience anything concerning, reduce the dose, take a break, and talk to your medical provider. So, contraindications. While KPV is generally very safe, there are some situations where I don't recommend to use KPV and should be cautious. Pregnancy and breastfeeding. Not enough research yet, so avoid during this time. Active infections. Since KPV modulates immune function, use caution if you have active bacterial or viral infection. Autoimmune medications. If you are on immunosuppressive drugs, work with the healthcare provider to monitor interaction and make sure you follow up regularly. Recent surgery. While KPV promotes healing, timing matters. Wait until initial healing phase is complete. Cancer treatment. If you are undergoing cancer therapy, discuss with your oncologist first before starting this therapy. The bottom line, KPV is much safer than most pharmaceutical, but smart usage means being aware of this consideration. Now, combination therapy with other peptides. This is where KPV really shines. It plays incredibly well with other peptides. Let me share some powerful combinations. KPV plus BPC 157. This is like a dream team for gut healing and tissue repair. BPC 157 handles systemic healing while KPV focuses on inflammation. People with severe gut issues see incredible results with this combo. Next is KPV with TB500. Perfect for athletes. TB500 promotes tissue regeneration and flexibility while KPV reduces inflammation and speeds recovery. It's like having a premium insurance for your body. KPV with GLP-1 agonist like trizeptide, semaglutide. This combination is revolutionary for metabolic health. GLPs handle blood sugar and weight management, while KPV reduces the inflammation that often accompany metabolic dysfunction. And KPV with CJC1295 ipamorelin. Growth hormone peptides plus KPV create an environment for optimal recovery and body composition changes. The anti-inflammatory effect of KPV enhances the anabolic benefit of growth hormones. Now, timing matters. Generally, take KPV in the morning, PPC 157 twice daily, TB 500 2 to 3 times per week, and GLP-1 as prescribed. Space injection by at least 30 minutes. Cycling. So some people run KPV continuously, others cycles 8 to 12 weeks. I usually recommend to cycle after 8 to 12 weeks for at least 4 to 6 weeks. This gives your body enough time to reset and rejuvenate. KPV peptides represent the future of personalized medicine. Instead of suppressing symptoms with harsh drug, we are giving our body the tool they need to heal themselves. What excites me the most is that KPV addresses the root cause of many modern health problems, which is chronic inflammation. Whether you are an athlete looking to optimize performance, someone dealing with digestive issue, or just want to age more gracefully, KPV deserves serious consideration. Remember, peptides aren't a magic bullet. They work best as part of a comprehensive approach that includes proper nutrition, exercise, sleep, and stress management. But when used correctly, KPV can be the catalyst that takes your health to the next level. Start low, go slow, and track your progress. Most people notice improvement within 2 to 4 weeks, with more significant changes by 8 to 12 weeks. You are wasting your money and worse, risking your health because no one told you how to actually use MK677 properly. Today, I am fixing that for good. What's up everyone? This is J. Patel, a certified PA specializing in hormones and medical weight loss. If you have been confused about how to take MK677 dosage, timing, cycling, all of it, you are in the right place. Today, we are breaking it down simple, fast, backed by real science. So let's get into it. Alright, so quick recap for new folks. MK677, also called as ibutamoren, is not a steroid. It's a growth hormone secretagogue. Basically, it tricks your brain into pumping out more natural growth hormone. And guess what? Growth hormone equals better fat burning, better sleep, faster recovery, and yes, muscle support. But if you take it wrong, you miss all those benefits. Or worse, mess up with your insulin level. So stick with me. So how much MK677 should you take? Most people overdose themselves. It's not about more being better. For the average adult, 20 to 25 milligram per day is a sweet spot. Going higher like 50 milligram increases your chances of bloating, numbness, insulin resistance, and feeling like trash. Stick with 20 to 25 milligram daily, period. So when should you take MK677? Here is where people really mess up. MK677 has a half-life of about 24 hours. That means it stays active basically all day after you take it. So you only need it once per day. Now when you take it, depends on your goal. If your biggest goal is better sleep and recovery, take it at night, before bed. If you're chasing maximum hunger for bulking or energy boost, take it in the morning. Just don't overthink it. Pick one time and stick with it like brushing your teeth. Keep it super simple. So how to take MK677 the right way? Alright, so here's the real how part. MK677 is usually taken orally. Just swallow it with 8 to 10 ounces of water, ideally at the same time every day to keep blood level stable. Now about food. Does it matter? Slightly. Taking an empty stomach might give a stronger growth hormone pulse. But honestly, if you feel nauseous, take it with food. No magic rule here. Consistency is the king. And guess what? No crazy preloading. No crazy cycling unless you are staying on for over 6 months straight. Most users go 6 to 12 months on and take 1 to 2 months break. That's it. So why it works? MK677 has alleged studies backing it. A study published in the Journal of Clinical Endocrinology and Metabolism found it boosted growth hormone and IGF-1 levels significantly without serious side effect in healthy adults over 12 months. Another trial at University of Virginia showed MK677 improved sleep quality and increased REM sleep cycle, major for recovery and fat loss. So the point is, when used right, it's one of the safest growth hormone boosters available today. To wrap it all up, don't overcomplicate this. 20 to 20 milligram daily, once per day, same time, stay consistent. Your future self will thank you. Most people use Sermorelin completely wrong. Wrong dose, wrong timing, wrong schedule. They are throwing that money away and it's killing their results. In this video, I'll show you how to optimize this peptide for maximum results without even touching synthetic HGH. I will break down exactly how it works, the science behind each protocol, and how to stack time and cycle it for the real results. So let's get into it. Hi, I'm Jwalant Patel, a certified physician assistant. I specialize in hormone optimization, performance improvement, and weight loss. What Sermorelin does at the cellular level. Sermorelin is a synthetic analog of growth hormone releasing hormone, or GHRH. It's not the growth hormone itself. It's a signal peptide. It works by binding to receptors in the pituitary gland, stimulating your body's own natural growth hormone production. That's important because instead of bypassing the body's regulation like synthetic HGH does, Sermorelin allows the normal feedback loop to stay intact. When Sermorelin activates the pituitary, it increases the growth hormone pulses, especially at night. The GH then gets converted by the liver into IGF-1 or insulin-like growth factor 1, which is responsible for most of the growth hormone effects. These effects includes increased lean muscle mass, fat oxidation and reduced visceral fat, improved deep sleep and REM sleep, tissue repair, especially post-training, cognitive protection via neurogenesis, and anti-aging support through mitochondrial signaling. Growth hormone is secreted in pulses, not steadily, so the way you dose Sermorelin must mimic this natural pulsatile rhythm. If you overstimulate the receptor, you lose sensitivity. If you underdose, you see no results. Next, we'll break down each protocol. There are three main ways to dose Sermorelin: nightly, pulse therapy, and cyclical protocol. Each serves a different goal. The first one is nightly protocol. This is a standard protocol for Sermorelin. This classic protocol is 200 to 300 microgram injected sub-Q at night right before bed daily. Why at night? Because that's when your body naturally releases growth hormone during the first 90 minutes of sleep, especially deep wave sleep. By aligning your circadian rhythm, you amplify the body's own growth hormone pulse. This works well for people with low baseline growth hormone, disrupted sleep, or over the age of 50. Number 2 is pulse protocol. This is more for the advanced user. Instead of daily use, this protocol uses Sermorelin 5 days per week, often paired with another GHRP like ipamorelin. Pulse dosing allows the pituitary to reset in between injections. It mimics the body's own natural growth hormone pulsatility, which is essential for preventing receptor desensitization. This protocol is ideal for people looking to build muscle strength and performance with less long-term suppression. And the third one is cyclical protocol. This is longevity focused. This method rotates 8 to 12 weeks on and 4 weeks off. You allow full receptor recovery and maintain long-term pituitary responsiveness. Cyclical use may reduce the risk of IGF-1 overexpression, which is linked to accelerate aging if pushed too high for too long. Which one is the best for you? That depends on your age, IGF-1 level, training intensity, and goals. So when to inject Sermorelin? Always inject Sermorelin on an empty stomach at least 90 minutes after your last meal. Why? Because insulin and glucose suppresses growth hormone release. Post-meal injection can reduce the growth hormone pulse by up to 50%. Inject right before sleep or 30 minutes before training if you are using as a pulse stimulator. Where to inject? So subcutaneous abdominal fat is ideal. It allows for gradual absorption and sustained growth hormone stimulation. Avoid intramuscular injection unless specifically combined with the fast-acting GHRPs. And how to mix it for proper dosing. Reconstitute 3 mg of Sermorelin with 1.5 ml of bacteriostatic water. That gives you about 200 microgram per 10 units of insulin syringe. Stored in a refrigerator for up to 30 days and always use the sterile technique. So there are multiple ways to choose the right protocol for Sermorelin injection. Number 1 is based on your age. So if you're under 35-year-old, pulse or cyclical works best. 35 to 50, nightly or pulsed, depending on the sleep and recovery. And over the age of 50, nightly for 8 to 12 weeks and then cycle off. Number 2 is based on your IGF-1 level. Low level with less than 100 ng per ml, nightly dosing for 12 weeks. Mid-range, which is 100 to 200 ng per dl, pulse or nightly protocol works the best. In high to normal range, consider peptide stacking or modulation instead of increasing the dose. Number 3 is based on your goals. If your goal is fat loss and sleep, nightly protocol. If your goal is muscle building, pulse protocol plus resistant training. And if you're more focused on longevity, cyclical use with lifestyle support. And number 4 is based on other hormones. If you are also on testosterone therapy or testosterone replacement therapy, monitor estradiol because growth hormone can indirectly raise aromatase activity. Make sure you check the labs periodically because balance is the key to get the best results. So stacking Sermorelin with other peptides. The first stack, Sermorelin with ipamorelin. This combination hits both GHRH and ghrelin receptors. It enhances growth hormone pulse amplitude and duration. Use 300 microgram of each 5 times a week. Number 2, Sermorelin with CJC1295, no DAC. This prolongs growth hormone releasing window. It's useful for flattened nighttime growth hormone rhythm. Number 3, Sermorelin with glycine. This natural amino acid boosts growth hormone during sleep. Combined with Sermorelin, they increases growth hormone output and recovery. Number 4 is Sermorelin with berberine. This combination improves insulin sensitivity. Lower insulin equals stronger growth hormone response. This combo supports body recomposition when used with proper training and nutrition. Next is growth hormone optimization with nutrition, sleep, and lifestyle optimization. Number 1, sleep. Growth hormone is released in deep sleep, mostly the first 90 minutes. Protect your sleep hygiene. No screen time 2 hours before bed. No alcohol or caffeine late in the day. Maintain consistent bedtime. Consider magnesium or glycine for deeper REM sleep. Number 2 is training. Resistant training stimulates growth hormone, especially compound lifts. Training 4 to 5 days per week. Focus on progression and recovery. Number 3, macronutrient. Growth hormone is blunted by carbs. Try high protein, moderate fat and low carb dinner if injecting at night. Number 4, micronutrients. Zinc, vitamin D, B12 and magnesium all support growth hormone production. Deficiency will reduce Sermorelin's effect. So make sure you optimize all the nutrients and improve your overall lifestyle for the maximum benefit. And the last thing is Sermorelin mistakes to avoid. Number 1, injecting after meal. Insulin and carbs shut down growth hormone. Always inject on an empty stomach. Number 2, never cycling off. Constant stimulation can reduce receptor sensitivity. Use pulse or cyclical protocol to maintain long-term results. Number 3, relying on IGF-1 labs only. IGF lab levels are helpful but doesn't capture sleep quality or recovery. Track outcome holistically. Number 4, ignoring stress and inflammation. Cortisol blunts growth hormone release. Manage stress with proper sleep, adaptogen and recovery. Improve your overall lifestyle for the maximum results. If you are going to use Sermorelin, use it right. Understand the science. Pick the right protocol. Support it with sleep, nutrition and training. And don't chase the dose, chase the signal. And make sure you follow up with your medical provider. Make sure you are keeping yourself healthy. If you find this video helpful, subscribe for more deep dive videos like this. I am Jay Patel. Thanks for watching and I'll see you in the next video.